Good morning, distinguished ladies and gentlemen. You're very much welcome to this program, which will be starting off formally very soon. I'll be your anchor for the day. I'm Remy Adesheun. I am the Director of Salient Advisory, and I will be really pleased to steer you through to this program and anchor the panel discussion that will take place. But just as we're preparing for the kickoff, as part of their health and safety protocol, the management of this beautiful hotel, the Lagos Marriott, would like to take us all through some basic guidelines and information. So let me invite the Marriott staff to please do that.
Good morning, everyone. Once again, you are welcome to Lagos Marriott Hotel Ikeja. My name is Yinka Osho. Quickly, we just have to give you the safety tips for the hotel. First and foremost, let's be reminded of COVID-19 and make use of our face masks. Check the person beside you if he or she is using our face masks. Please kindly do so now. Secondly, please let us ensure to maintain social distancing. And thirdly, please sanitize your hand. If you check maybe your table or at the point of entrance, there's hand sanitizer everywhere. So just make sure you sanitize your hand regularly. And going forward, if you are to visit the restroom, just walk out a little bit on your left and walk down. You will see a restroom. Or walk out on your right hand, you will see some of our staffs. Just ask them, they will direct you to the restroom. And if you are going to the restroom, please just make sure everything that you are taking to the restroom, you keep it very well, because just recently some of us are forgetting our phone, iPad at the restroom there, but fortunately we are able to get them back. But please just make sure everything that you are taking down there, you are taking it along back with you. Another thing is, in case of fire, our fire procedure, first and foremost, before I go into the fire procedure, you will see around we have the sprinkler. There's a sprinkler. I hope some of us are familiar with the sprinkler, and we have a smoke detector. The smoke detector is on the high side. It will trigger anything, smoke or dust, it will just trigger. So in case of the fire alarm is being, you will be notified if you are to move out of the or not. So do not panic. We'll notify your coordinator. At times we might have a false alarm, so do not panic. And if you check around, you will see a break glass, which is red. If you see on the wall, there's a break glass. So in case there's fire here, you can just break it to trigger the alarm, and will come. And so in the event of fire, it is important that we are aware of the following. A continuous alarm bell will be signal for evacuation. Please, in case of fire, do not panic and do not make use of the lift. Do not make use of this. It's not advisable for you to make use of the lift. Raise an alarm by breaking the near glass. I've just mentioned that earlier. Now we have our muster point. Our muster point is outside. Our staffs will always, and our fire response team, they will tell you when you need to move. Our muster point is outside the hotel, in front of the hotel. And do not enter the building. We will tell your coordinator when you are meant to enter. Thank you very much.
Thank you very much for those very helpful tips concerning our health and safety. As I said, while you're in the room, please do make sure you have your face mask on at all times. And for the people at the back, just to be sure, can you hear very well from here? Excellent, thank you. And with the consent of the organizers, this is an event that has been put together by Sterling Bank, a bank that has become very well known in Nigeria for its strategic interest in the health sector. They've done many wonderful things to demonstrate this, to support organizations and to support the health system as a whole in ensuring that we are better prepared to achieve universal health coverage in Nigeria for our people's benefit. And they're doing this program today in collaboration with the Healthcare Federation of Nigeria, whose leadership is well represented in the room, from the president, Dr. Pamela Ajayi, whom I'll invite you to please give a round of applause. Dr. Pamela Ajayi is very well supported by our executive committee, including the immediate past president of the Healthcare Federation of Nigeria, who also happens to be the founding president of that federation, but the current president of the West Africa Association of Private Healthcare Federations, Ms. Claire Omasheye. Please give her a round of applause as well. The other members of the executive, the vice president of HFN, as Healthcare Federation of Nigeria is also sometimes called, Njide Ndili. A round of applause for her. She's the country director for Farm Access. And without turning this into an introduction session yet, I just want to welcome you all and thank you for your presence. I believe we do have a great number of our special guests and especially our speakers who will also double as panelists in the structure of the program. So if you look at your program, the flow is such that the president of the Healthcare Federation of Nigeria will lead to give a sense and set the stage of the role of the private sector in this entire COVID-19 vaccination program. And the idea is that having set the stage, the national leadership of the agency tasked with the responsibility of ensuring that Nigerians benefit from protection from this virus through vaccination. The National Primary Healthcare Development Agency, the executive director is expected to join us, or his representative, to let us know the state of affairs. What's the progress report on the vaccination program so far? The Honorable Commissioner of Lagos State, Ministry of Health, whose state has taken the lead almost in terms of the strategic thinking in countermeasures to address this pandemic, and who has done an incredible job in keeping Lagosians safe, is also here, and he'll be talking about the gaps. But let's recognize him at this time. Please put your hands together for Professor Akin Abayomi. I'll just do a quick check with the organizers, and I'll appreciate if Wale could join me on the stage. I need to check a couple of things in terms of the presence of the speakers. But from Professor Abayomi's presentation, which will be on identifying the gaps and also looking at potential consequences and strategies to overcome those gaps, we'll be looking at what the national strategy is. So, given the nature of Nigeria's health systems, the fact that health is on the concurrent list, cooperation between the national level and the state level is always critical. And therefore, we'll be listening also to the national coordinator of the Presidential Task Steering Committee on COVID, Dr. Mukhtar Mohammed, who will also be giving us that overview of the national strategy. This pandemic has got its name just by the shared force of nature by which it has taken the whole world down. So we're not in this alone. There's a lot happening on the international stage, and to give us a sense of what's going on in other places in West Africa, and especially on how the private health sector can really be a partner to accelerate the control of this pandemic. We'll be hearing from the president of the West Africa Association of Private Healthcare Federation, Claire Omashehe. And to wrap it up in terms of the presentations, the burden that the COVID-19 has put on the world is not just in its public health effects only, it's also in the very significant effects it has on financial stability of the entire world. And in bringing out vaccine programs and having successful rollouts, it is essential that a very sound financial strategy is adopted. And so, none other than the chief executive of the Sterling Bank itself will be taking us through the economic considerations for successful vaccine rollout. And I'm talking about the Mr. Abubakar Suleiman, MD CEO. Is Mr. Abubakar Suleiman in the room? I know he's in the building. Is that you? Okay. I know he's in the building, and so I'm sure he will join us very shortly. So that's the lineup we have for you. We'll then break into a panel discussion, which I'll also moderate, and we'll be able to get, a cross-fertilization of ideas among the speakers, and will also afford the audience your very good selves coming from broad walks of the health sector, as well as the media, to engage with the panelists in a Q&A session, after which we hope that the leadership of the state, in terms of His Excellency and the incident commander, as the HC usually refers to him, His Excellency Governor Babajide Sanwo-Olu, we hope he will be able to join us, or his representative, as well as the Honorable Minister for Health, Dr. Osage. That's the lineup for today, and in just a couple of minutes, we'll ask for the National Anthem, and we'll start the program formally. Thank you, and do enjoy the program. Keep your valuables, keep your contributions at the tip of your fingers to make them as the time permits. And also know that this program is being streamed live on social media, on Facebook, Instagram, and not on the other one, whose name we're not even sure we're allowed to mention, right? But which we have all found a workaround as resilient Nigerians to deal with. But within the limits of the law, all the appropriate channels, others who are unable to physically join us in the room, will be listening and possibly contributing. Thank you very much. We'll take a 2-minute break, just so one more chair can be added here, and we'll have the National Anthem and kick off the program. Thank you. It's okay to clap for me if you feel so inclined. Never mind that I asked. Thank you. Being said, and just before the National Anthem, let me also introduce the Sterling Bank team who have worked so tirelessly to put this together. I mentioned the Chief Executive and Managing Director of Sterling Bank, Mr. Abubakar Suleiman. But working behind the scenes to see to the success of this is the Divisional Head for Health and Education in Sterling Bank, Mr. Obina Ukachukwu. Can Mr. Obina Ukachukwu please rise for recognition? And can we please give him a warm round of applause? We also have the group head for health, who is behind the scenes ensuring that everything is going well. Please put your hands together for Mrs. Akimade. And of course, the team, well supported. I've seen the communications, head of communications is the gentleman who's running behind there, making sure things work. A round of applause for him. A round of applause for him, please. Thank you. And Mr. Adewale Adeboale, also of the health desk of Sterling Bank. A round of applause for him as well. Thank you very much. So we've got the adjustment now. The chairs are set, and we'll just about start now. It's Commissioner now. So, technical crew, please prep the national anthem. We'll rise for the national anthem in a minute. You can play some light music in the background while we wait to take the national anthem. Thank you. vaccination gap in this room or the absence of it? So if you have had at least one vaccination, please indicate by a show of hands. Let's see how well covered we are in the room and the gap that exists in this room. Okay, there's a big gap in this room. Okay, hands are coming up. That's great. We're a bit more encouraged. And if you've had all two, in which case your ability to hug and shake can be restored, let's see by show of hands for all two. Okay, so you see that circle? I should actually put you on the same table. So don't forget, it's important to still maintain the social distance. The instinct is there. For some of us, this is the first time we're seeing ourselves after many months. So the instinct of that hug is still there. If you can hold back. And we'll have the national anthem and kick off in earnest. Hopefully we'll be able to claw back some time so the program can end as scheduled at 2 p.m. and we can wrap up for the day. The lectern, and then we're all on this side of the house. Except you have an alternative suggestion. Obina, I can't see through your mask, but it looks like your eyes are telling me something. So please feel free to let me know if you want it done differently. But for now, can we have the national anthem? It's 11:35 now. Let's rise for the national anthem, please. Thank you very much. Please be seated. And I'd like to invite to come on the stage as a co-host of the event to welcome the other guests, the President of the Healthcare Federation of Nigeria, Dr. Pamela Ajayi. A round of applause for her as she comes up. She may have one or two things she's finishing, but she's up in spirits. Okay, she's actually coming up physically, so great. Please keep clapping until she comes. I know she didn't get to Lagos from Abuja till very late last night. Very committed leader. She's been ensuring the voice of the private sector is being heard loud and clear and collaborating with partners in government and development. Thank you very much, Dr. Ajayi, for all you do for HFN. And by way of protocol, the most senior citizen in this room is our Honorable Commissioner, the Honorable Commissioner for Health in Lagos, distinguished Professor Akin Abayomi. Can we please give him a round of applause? I understand that Dr. Mukhtar, the National Coordinator of the Presidential Steering Committee, is already on his way. He's probably on the bridge. Please feel free to sit here, sir. And so we'll be calling him. The next person is Dr. Mukhtar, and following is the President of the West Africa Healthcare Federation, who has been making eye signals I can't see well because of my mask, Ms. Claire Omasheye. A round of applause as she comes up stage. Thank you very much. And to complement and ensure we get the full financial backing for this project and this program, let me invite the MD/CEO of Sterling Bank, Mr. Abubakar Suleiman, to take a seat if he's already in the room. If he's not there, a seat is reserved, and that completes those who are in the room now. We may now proceed formally. I would like you to all please be seated, and let's spend the next 2 to 3 hours having quality conversations on how to close the gap in the vaccination program in Nigeria. What is the role of the private sector? That's the goal of this. Complementarity is what makes health systems function, and the private sector together with the public sector is what constitutes the health system. So making sure we use all of the resources at our disposal is the surest way to achieving success for any health program. At this point, I'd like to invite the President of the Healthcare Federation of Nigeria, Dr. Pamela Ajayi, to give our opening remarks and highlight the role of the private sector in vaccine distribution and in vaccination programs in general. A round of applause for her, please.
Good morning. Our Honorable Commissioner of Health, Lagos State, President of the West African Federation, other distinguished guests, permit me to stand on established protocol as I start the discussion this morning. This morning we are talking something that's very important. We're talking about the pandemic, and we're recognizing the issues that we currently face as a nation today. And the question that is before us now is, what role can the private sector play in helping us take control, in helping us to bridge the gap in this pandemic as we find ourselves struggling, as with the rest of the world, to control this pandemic? Next slide, please. The first slide that I have outlines the issues with regard to the private sector. Why do we need the private sector? It's no news to anyone that there's a huge gap between the public, between the countries that have a lot of money, the richer, more developed countries, and what they call the low middle income countries. The slide shows clearly the difference of the developed countries which are well vaccinated and our countries which are not. This leaves us here in Africa in particular at great risk. Now, what can we do about it? The private sector can do a lot and can actually do a lot of things, from beginning at the supply, the funding, to the manufacturing, to the distribution, storage, and administration of the vaccines. There's a lot that the private sector can do, and sorry, 1 second. Thank you. So, what I was explaining was that it is very important that we understand the motivation for the private sector. The private sector is motivated and incentivized to participate in this vaccination rollout because the pandemic has already adversely and significantly impacted upon the economy and the ease of doing business in the private sector. And so the private sector needs to have things return to normal. There are so many steps in the process which I have mentioned that it is clear that from the government perspective, there's a need for help. There's a need for the government, instead of focusing on capacity building, to actually partner with the private sector players to help support this initiative. Next slide, please. In Nigeria, private sector contributes more than 60% of health care provision. And next slide, please. And in Nigeria, the Healthcare Federation has actually played a huge part working with the private sector to complement the efforts of the government. And I'd like to stress at this point, when I talk about the private sector, I'm not just talking about the private health sector, I'm talking about the private sector in general. We have worked through from laboratory testing to case management. We've held hands in data collection and monitoring, central coordination, logistics, and supplies, and also in the case of sensitization and capacity building. All through the pandemic, from the beginning, we have played a part. And so it is only right that we should, at this point, be called on to assist or to, sorry, next slide, please, in the rollout going forward. So here we see a number of our private sector players who have actually contributed considerably, and this is not an exhaustive list of many people who have worked tirelessly, contributed so much in this fight against COVID-19. Next slide, please. So what we have are so many vaccines. There are many vaccines, but interestingly, we here in Africa are not getting very many. In fact, we're getting so few. So, next slide. How can the private sector support Nigeria's COVID-19 vaccination program? Next slide. In terms of supply, there is a role for both the government and there's a role that the private sector can play. I won't go into much detail because I know I don't have that much time, but suffice it to say that the role of government is to secure and maintain an efficient supply of vaccines for the population. And as you know, our country has only less than 1% of our country has been vaccinated. And this actually is a huge worry because if you recall India's situation, in India they had vaccinated less than 8%. And look at the problem that evolved. At any time, anything could happen to us, and that's why it is so important that we work on this together. The private sector can play a role with assisting the government to augment its supply of COVID-19 vaccines. And once the government has done its role, and that role, for example, would include things like approving the kind of vaccines that should be available for use in the country, and defining exactly what we need to have done, the infrastructure, and in particular the regulatory and monitoring framework and guidelines that the private sector needs, then the private sector can do a lot in terms of mobilization, in terms of funding. Next slide, please. No, I think the previous slide, sorry, the funding slide. And it's very interesting to note that HMOs, for example, can procure vaccines on behalf of their enrollees, and there are a number of institutions, large corporations, who can undertake CSR initiatives to contribute funds for the administration of the COVID-19 vaccine. Next slide, please. The access to vaccines is very important. It's not possible for, particularly since private sector plays such a huge role in providing care in the country, the access points are available in the private sector. It can be private primary care centers, or it can be actually, as other countries have done it, by utilizing the wider range of, and I will be explaining that later, of what other countries have done in terms of working with pharmacies, in terms of working with labs, in terms of working with even offices, leveraging the networks that are available, people like the Rotary Club and other large-scale clubs for vaccine administration. These are all things that can be done. Next slide, please. It is very important that we look at the people who have the ability and who are willing to pay for the vaccine and make sure they're able to do so. There are still a number of people who are extremely anxious because they cannot, they cannot access the vaccine, and they're very worried. A lot is being said about vaccine passports and a lot of difficulty people are going to have if they don't get the vaccine. And that is key. Next slide, please. In terms of the citizen and inoculation and education, it is important to note that we have the technology, the digital platforms, and can accelerate and create modules for learning and for monitoring and evaluation that are required. Track and trace systems have been developed in the private sector, which can link into the public sector ones, or which can be used instead of the public sector ones, in addition to it, shall we say, or to augment it, and also to realize that we have a lot of capacity within the private sector for the storage of the vaccines, from even the minus 70-degree freezers all the way to the normal ones. There's a lot of capacity, and this capacity is, we are very keen to supply it and work with the government on it. The private sector is ready and willing and able to do all of these things and can augment the government's ability to do what needs to be done. There are several opportunities and there are several benefits and challenges that come with this. And the opportunities include research and development, manufacturing, amongst other things. And the benefits I have already outlined. But there are certain risks and challenges. The risks of quacks, the risks of gaps, and the risks of the fact that it may be driven by interests other or that may be in conflict with public gain. So these are some of the challenges that exist. But I would like to just emphasize that around the world, next slide please, there have been a lot of people or a lot of organizations and companies that work hand in hand with the public sector to ensure that we deliver on the promise that is to try and ensure we get to the herd immunity which we all need. In Ghana, for example, on the 30th of March, the M-Pharma brought in a huge amount of vaccines to help through a bilateral supply agreement to procure additional vaccines for the Ghanaian government. And this has been in addition to the fact that a lot of companies are sponsoring the vaccination of their employees. In the Philippines, for example, the government realized that without the private sector involvement, it would not be able to achieve its goal of vaccinating 70% of the population, and has worked in every aspect with the private sector, from funding the purchase of millions of doses, to supermalls offering their malls to be used as vaccination centers, to multiple public-private partnerships geared towards successful national campaigns. So and if we go on to the next slide, you will see that in different ways, next slide please, in different ways, for example, India, Ghana, we've talked about, Democratic Republic, there are so many ways in which the private sector can assist the government in doing what needs to be done, from manufacturing in India, which we in Nigeria could do. South Africa is already manufacturing vaccines, from procurement, for example, in Ghana, to service delivery and even rollout. If you look at, for example, in the United States, apart from using pharmacies and other institutions, Starbucks actually played a part. And interestingly, the company IKEA opened up its parking lots in Israel to show that, you know, to work in partnership with the government to ensure that these things were done. Now, if you go on to the next slide, and the next slide, and the next slide, please. My time is up, but I'd just like to put a word of caution. This is not OMO, you know, that we are bringing